All right. Hi, everyone. My name is Crystal Ward. I'm an oncology social worker and will be presenting on organizing and facilitating a brain tumor support group. All right. Hello, everyone. My name is Crystal Ward. I'm an oncology social worker and will be presenting on organizing and facilitating a brain tumor support group. I don't have any conflicts of interest. And today's agenda, we're going to start off with why to start a support group, different types of groups, how to plan and start your group, facilitator and communication techniques, some of the issues that impact your ability to retain members, and ways to care for yourself as a support group facilitator. And at the end, I'll share with you a little bit about ABT resources available to you. So I'm going to start today talking a little bit about Dr. Yellen. Dr. Irvin Yellen is a professor emeritus of psychiatry at Stanford University. He's a leading expert in group psychotherapy, and his book, The Theory and Practice of Group Psychotherapy, is a really great resource for support group facilitators. Knowing that most of you won't be able to read through his almost 600-page book before you start your group, I'm going to give you just a little brief review of his 11 therapeutic factors so that you have a base understanding of the reasons support groups can be so beneficial, specific to our members with brain tumors and those caring for them. So the first factor that Yellen talks about is installation of hope. According to Yellen, hope is required to keep members attending the group. Whether a person is newly diagnosed with a brain tumor or is further along in treatment, hope is maintained within the group setting. The support and encouragement members provide to one another gives them hope and facilitates resilience for them to face the diagnosis. Whether it's hope for treatment to work, hope for meaningful connections with others, or when a member faces end of life, hope for a meaningful death. This is something a group helps to sustain. Universality, being told that you or someone you love has a brain tumor can be incredibly isolating. It is a rare diagnosis, and it's unlikely there are a lot of people in their life who have been exposed to such a situation. A brain tumor support group offers a common connection for patients and their loved ones to a group of others who have truly been there. Imparting information. So the benefits of patients with a brain tumor and their caregivers connecting in a support group is that they have an environment to share important and helpful information with one another. Whether it's tips for how to navigate the medical system, how to communicate their diagnosis with family and friends, or caregiver tips like how to cope with the patient's cognitive and personality changes. This information can be delivered by trusted and experienced members. Many groups also incorporate an educational component for the first half of their meetings, inviting professionals to speak on various topics of interest to the group. And the fourth factor, altruism. Group therapy offers both patients and their caregivers an opportunity to shift between roles of help receivers and help providers. For patients who may be feeling as though they are a burden, they have the refreshing role of helping others through sharing their experience. And for caregivers who may be putting themselves last, they have the opportunity to receive help from and care from others. The fifth factor, the corrective rehabilitation of the primary family group. Often if a family was struggling with relationships or communication prior to their diagnosis of someone with a brain tumor, the diagnosis can actually increase this dysfunction within the family. And according to Yellen, support groups resemble a family in many ways. There are authority, parental figures, peer sibling figures, deep personal revelations, strong emotions, deep intimacy, as well as sometimes hostile and competitive feelings. So the facilitator plays a really important role in helping members acknowledge their feelings and help them work through any conflicts, showing them how to repair relationships and communicate more effectively, also relating back to their family group. Development of socializing techniques. The nature of the brain tumor diagnosis can be very isolating for both the patient and their loved ones. As mentioned, communication and relationships within the family, as well as with friends and coworkers, can be impacted. The group offers an opportunity for them to receive honest, open feedback about their experience and input from other members about how they are perceived by others. This can be a rich opportunity for them to learn how they contribute to their own isolation and offer opportunities for them to learn strategies for expressing their needs and feelings with their support system. Imitative behavior. Yellen notes the importance for members to watch how one another work through problems and difficult situations. This can be particularly important as members in brain tumor support groups face making treatment and end-of-life decisions, communicating important information with their medical team, and sharing their needs with family and friends. Imitating the behaviors of other group members offers them an opportunity to try on the behaviors themselves and then relinquish anything that they find doesn't fit for them. Interpersonal learning. There's a lot of data on the innate human need to belong. Unlike individual therapy, the therapeutic setting of a group offers members the opportunity to feel they belong within a social group. Although patients and families in the midst of the diagnosis may feel disconnected from their peers and even extended family, they have an opportunity to connect with other group members and develop their own strength and resilience and place where they belong. Number 9 is group cohesiveness. According to Yellen, groups generate a positive self-reinforcing loop of trust, self-disclosure, empathy, acceptance, and then back to trust. The group will accept the individual provided they follow the group's procedural norms, regardless of the member's past experiences, transgressions, or social failings. Establishing a non-judgmental and inclusive environment at every meeting reinforces this positive cycle and therefore helps to fend off depression, anxiety, and isolation among the members. Number 10, catharsis, or the process of releasing strong, sometimes repressed emotions, can be very therapeutic in a group setting. A brain tumor support group may be the only place where patients can honestly share their fears, anger, and sadness regarding their experience. And same for caregivers, having the opportunity to address caregiver burnout, guilt, anger, grief within a group who understands can empathize with what they're experiencing is a really important benefit of the brain tumor support group. And lastly, existential factors. Similar to Calvin and Hobbes here, support group offers members the opportunity to confront the harsh existential facts of life, our mortality, our freedom, and our responsibility for constructing our own life design. It helps members recognize that life is sometimes unfair and unjust, and ultimately there's no escape from some of life's pain or from death. That no matter how close they may get to other people, they must still face life alone, and they must face the basic issues of their life and death, and thus live life more honestly and be less caught up in trivialities. It also teaches them that they must take ultimate responsibility for the way they live their life, making the most out of each moment, no matter how much guidance and support they may get from others. So Yellen's therapeutic factors provide a structure for understanding the benefits of support groups, but ultimately each member will find their own meaning and benefits for attending the group. As this one caregiver noted, it was the sole fact that she was not the only one caring for someone with a brain tumor. As you establish your group, the members will share with you what they value and are looking for in a support group. It's really important to take their lead. I'm going to now talk a little bit more about the mechanics of starting a support group. Let's start off with who attends and basic members of a group. Most brain tumor groups have a mixture of these types of individuals. Depending on the need in your community, you can be inclusive of all of the members, or you can narrow your group to just a few members in a specific category. For example, maybe just for caregivers or just for benign brain tumor patients. Some groups meet all together in the beginning of their meeting and then split into caregiver and patient subgroups for the second half of their meeting. It's really up to you and the group what you decide. Who facilitates the group? Groups can be led by paid or volunteer professionals, by group members, or by a combination of both. Group leaders are also called facilitators because they make it easy and comfortable for everyone to participate in the discussion. In addition, facilitators intervene and help participants work through confrontations or disagreements, which we'll talk a little bit more later on. And groups run by patients and family members are often called self-help rather than support groups. And self-help group members share experiences and learn coping skills from each other. Professionals such as social workers, counselors, and psychologists have specific training and experience in running groups and have knowledge of group dynamics. They may also be better equipped to handle problems that arise, such as one individual monopolizing the group, or if someone has needs that can't be met by the group. In addition, having a professional there, they may be more qualified to screen new participants than, say, patients and family group members. Co-leadership. So just like Batman and Robin, having co-leadership allows you to be more successful. If one leader is unavailable, a co-leader fills in and provides continuity. Co-leaders also provide each other with support and the opportunity to share emotionally after difficult meetings. If the co-leaders are from different disciplines, such as maybe a nurse or a social worker, a blending of skills is an added bonus. As Mary Lovely, our nurse here at ABTA, who has been a longtime facilitator of a brain tumor support group in San Francisco, shared, having a co-facilitator to talk with at the end of meetings to debrief about what happened in the group has been a great way for us to support each other. It really helps put things in perspective and has even helped me sleep at night. So it's really good feedback from her. And a co-leadership, may not be feasible for all groups, but in those instances, if you can't get a co-leader to help you, I really encourage you to seek outside resources and support through your group. Types of support groups. So the first kind and the most common type of brain tumor support groups is an open-ended group. They meet for set intervals, such as once or twice a month, for an indefinite period of time. Members can join the group at any time and attend as few or as many meetings as they wish. Open-ended groups can be more difficult to lead because new members are continually changing the group's dynamics. And it's a challenge to the facilitator to sometimes integrate new members while not making the sessions overly repetitive for the returning participants. In addition, potential new members determine if the particular group or any group setting is appropriate for them, so they may only come once, maybe twice. So although there are a lot of challenges, like I said, this is the most common type of format for brain tumor support groups. You can also do a type of format called closed time group, if you so wish, and closed time group meets for a set number of sessions. So commonly it's 6 to 12 times over the course of a few months. The facilitator usually interviews participants in advance to ensure that the individual or group are a good match. And each session has a specific goal. A closed time group offers members the opportunity to develop really close relationships because there's more time for interaction and the opportunity to explore really important issues. There's also no distractions due to new members joining the group. Challenges with a closed time group is that members may be absent, and at that time the group may become too small for meaningful group interaction. And without the benefit of new ideas and viewpoints, the group does run a risk of having groupthink, where members avoid minority or outside opinions and kind of create an extreme sense of conformity. And this may happen if the group discussion becomes, overly negative, whether that's, medical bashing or just negative in their outlook, and they lack the ability to share in that hope, support, and optimism with each other. Close times groups with brain tumor support groups, it may be specific to newly diagnosed members, or maybe if there's a large population of people who have had a recurrence, that might be when it's appropriate to do a close time group. So now planning. So once you've established a group format, whether you're going to do open or closed group, it's important to create agendas for a set period of time. And this is even for the open format. You want to select topics, and for those open-ended groups, you might do 3 to 6 months agendas at a time, and then invite the guest speakers for each of those meetings ahead of time and give them enough time to prepare and plan for their meeting or for their presentation. Be sure to ask the group periodically what they're interested in and how the group is going, and make sure to adjust your program according to what those evaluations show you. And you want to close each meeting the same way. Here are a few activities that some brain tumor support groups have found helpful. One takeaway is where at the end of each meeting, each member shares one thing that they've learned during the meeting. A circle time, I've seen this quite a bit, is where the groups find gathering at the end and holding hand can be a nice closing. Sometimes you can offer time for silence, prayer, or some groups develop their own affirmation to say out loud. One word is an activity where you ask the members a question and ask them to reply with one word. So an example would be, what gives you hope? And then they would answer with one word. And my favorite activity that I like to do with groups is an activity called Head, Heart, Feet. You ask members to share with the group either something they've learned, something they've felt, or something that they plan to do as a result of the meeting. And you can be quite surprised with what they share, and it can also go back to those teachable moments for the group. Next is just retaining members and recruiting members. You want to, as soon as your group is established, you want to spread the word and make sure you can recruit. Minimally, probably 8 to 12 members is a good enough number to really keep your group functioning. You want to make sure that you keep within that range. A general announcement has the details of where you all meet. If you do need a RSVP for whatever reasons for your location size, make sure that information is included. And then you want to distribute it to as many people as you can that can get the word out for you. So certainly patients and their families, local oncology offices, radiation offices, cancer resource centers often have listings that they share with people who attend their workshops or activities. Social media, if there's any social media groups you belong to specific to the diagnosis or your own social network. And then definitely call the ABTA and let us know, and we'd be happy to post it on our website. Topics. So here's just a very, it is a little bit long, but these are some of the topics that we've heard have been helpful for brain tumor groups. You want to make sure, again, that you're evaluating the group to see what they're interested in, and that you're not having people speak on topics that, maybe turn off the members. So, depending on the group dynamics and what their themes have been for the past few meetings, maybe, they've had a lot of questions about healthy eating, and it's come up repeatedly 2 or 3 meetings in a row. It could be a good time then to have one specific group meeting on that and invite a dietitian. Same with some of the other topics there. There's usually specialists that would be happy to present on those topics. And if you're seeing themes throughout the discussion, it's good to bring in a special guest speaker. So for logistics, you want to make sure that you have a convenient location. And for patients with brain tumors and their families, it's going to be, making sure that it's easy to find, keeping it at the same place and time, and that information consistent so that they can remember it each month or each week that you're meeting, wheelchair accessibility, and make sure parking's available. You want to make sure that the room is set up in a welcoming way. A circle usually works best so that everyone can see each other. You may set it up classroom style if you're having those guest speakers, though. And then place to display information and announcements, a table near the back of the room. Also, having snacks and drinks is really great. And then a screen for your guest speakers to use for presentations if they have a PowerPoint. And you want to make sure you're arriving in advance. I would say at least 30, no later than 15 minutes ahead of time. You'll have some members that'll show up early. It's a good time to kind of connect with them. You also want time to post your signage, directing members to where the room is, and setting up any handouts that need to be placed. As people come in, make sure you're greeting and welcoming them, meeting those new members who are attending. And then at the beginning of each meeting, as you meet those new members as they're coming in, be sure to introduce them once the group gets started, so that everyone kind of knows their story and can connect to them. And make sure you have a way for members to sign in and provide their contact information so you can follow up with meeting updates. You want to make sure that you're starting and ending on time. Reminder at the end of the meeting for the next meeting date and time. And take notes for reference, such as if there was a theme to the discussion that night, any important announcements that were made from members that you want to remember. And then there's always going to be a few members that you want to check in with in between meetings, or who may need additional referrals or resources in between. So taking those notes and remembering to follow up with those members is important as well. Techniques. So definitely to start out a group and just to keep it consistent, you want to establish some ground rules and make sure that these are shared at the beginning of every meeting. Confidentiality is really important. You want to make sure that the discussion stays within the group and details aren't shared outside of the group setting, especially medical information. Discourage any sidebar conversations. Make sure that they're just being respectful to the person who's speaking. No medical bashing. Again, there's going to be doctors and maybe, health institutions that people want to, are frustrated about, that they want to share in their frustration, but make sure that it doesn't go on, and that can be really a turnoff for other members who may not feel the same way about that particular institution or doctor, so kind of restrict that. And then also make sure that they're not giving specific medical advice. Certainly, they're dealing with symptoms and side effects from treatment and just general questions about treatment. But you want to refer them back to their doctors because, everyone's individual circumstance is unique to them, and you want to make sure that they're following up with their doctors, not taking specific advice from certain members. So facilitator communication. You want to make sure that you're an active listener throughout the entire meeting, reflecting back to the group that you're listening to them. So a good phrase is, what I'm hearing you say is, that you're frustrated about this, or, that you really felt that was a good treatment for you, or, just reflecting back to them what they're saying. Be sure to encourage the timid. If someone hasn't shared throughout the meeting, maybe going back to them and saying, Susie, I'd really love to hear what you have to say about this, or what you're thinking on this topic. Acknowledge sensitive sharing. So we talked about you're going to have those, cathartic experiences with group members where maybe their first time sharing information with anyone, or feelings that they've had. And so just being sure to acknowledge that, it was really brave of you to share that with the group, and making sure they get support back. So has anyone else experienced what Susie here shared? And that can be really good at a teaching moment and reinforcing that support. All of those are teachable moments. And then restrain misinformation. If something's brought up and you know for a fact that it's incorrect, really make sure that you're correcting that information in the meeting setting, and not waiting until after the meeting to let them know. So when a group member dies, so unfortunately, given that many of your members may have a terminal diagnosis, it's important to acknowledge when a group member does die. You want to make sure that you're sending your condolence to their family on behalf of the group, and ask the family if it's okay for you to notify the other group members, and whether or not the members are invited to any type of funeral or memorial service for that person. It's also important to ask the group how they would like to be notified when a member passes away. Some prefer to find out only at the next meeting, while others may want to know ahead of time. A group here in Chicago, they decided that they would send out an email to the group with the subject line as gray notice, so that, when that email comes into their inbox, they know that it contains information about a member who has passed away, and they can decide if it's a good time for them to read that information or not. And it allows them to know ahead of time before the meeting, and they can kind of process ahead of time. For the actual meeting, so the first meeting where the member will no longer be present, you want to make sure that you're acknowledging that loss. It's best to do this at the beginning of the meeting so that it can be processed by the group early. Provide some time for them to kind of reflect on the loss, whether that's offering a moment of silence or being able to share any special memories that they had about the group member. And be sure that you're offering to be available to provide support after and between the meetings in case some members are having a difficult time kind of struggling with the loss of that group member. Conflict is really bound to arise whenever you have a group of different personalities and backgrounds. And here are just some simple tips to keep in mind when you have conflict in the group. You want to make sure that you're sticking to those ground rules and establishing some norms within the group so that they know what to expect in some of those rules. Make sure you're dealing with the here and now, not bringing up things from the past or hypothetical situations in the future. And make sure that your tone is calm and your body language is non-defensive. Explore differences, make sure to identify that everyone's unique and that people, approach things and cope with their experience differently. Make sure you're separating people from the problem, that you're focusing on the concerns that they're bringing up in the meeting. And make sure you insist on objective criteria, so that they're not bringing in kind of a biased perspective, and kind of acknowledging, again, everybody's different, and they may have different ways of approaching topics. So unfortunately, there's going to be some times where you have difficult group members, and you want to make sure that you're handling this really by owning your own communication. So using I or we statements rather than you. So a good thing to say is, I know things are difficult for you right now, but we're trying to understand Susie's situation, and it's hard when you keep interrupting. So this phrase really, it puts it on you, but it also lets them know how, they're impacting the entire group by saying, we are trying to understand Susie's situation. Also, that comes up as far as difficult group situations is when you have someone who kind of monopolizes the conversation, or, just is a very frequent contributor. And you want to just thank them for sharing, and, that you understand they have a lot to say on that topic, but you have some other members you'd like to, direct to and have them share their experience. And then this is also a good time to kind of reroute to those people who may be a little shy in the group and giving them an opportunity to be heard. So reasons for leaving a group. So, we talked about your member makeup is going to be lots of different people from different trajectory in the diagnosis. And, there's just going to be some people that the group's just not going to work out for them. And it's important to keep in mind, because you do want to retain your membership. You want to make sure that the group's successful and that you have a good amount of members to keep the group going and therapeutic. So some of the reasons are, and this is actually a study by Usher et al. In 2013 that was published in Social Work and Healthcare, and it's specific to the reasons why people left a cancer support group. And this is where they left, but they had a positive regard for the group. So it wasn't necessarily the group that they couldn't attend. It was these practical issues. So transportation, the timing of the meeting didn't work out. They just physically weren't healthy enough to attend, or they had other family responsibilities and, sometimes childcare, or if they're caregiver for multiple people. Those are some of those practical issues they found. Another reason that they found was that, some people it was time to move on, so that they felt that they were coping really well and more confident in their situation, and they didn't need the group anymore. And then in the same note, that time to move on was they just really wanted to kind of leave cancer or their identity as a cancer patient behind. You may get that with some of the members who have been having long-term survivorship, 5 years or more, and feeling a little bit more confident about their situation and not being able to relate to some of the newly diagnosed patients who are attending. And then the ability to maintain connections from within the group that they've made outside of group meetings. So they don't necessarily have to attend every meeting, because they're still gathering with group members outside and, more social activities. And then receiving positive support from family and friends. Their support system is just, coming around them, and they don't really need the support group to fill in those gaps. Just another reason why they may not need the group at that time. There are certainly negative reasons why the members may leave that are specific to the actual group. So dissatisfaction with the group leader. Maybe the group leader was unprofessional, or they weren't organized. And some members really talk about the facilitators overly controlling the discussion topics. So you want to keep that in mind, let the group organically come up with the topics and discuss amongst themselves, and, restrain that facilitation and to just when they really need it. There's also the atmosphere of the group. So people just may find it depressing if the topic is getting really negative, may find it boring, too focused on problems with doctors or treatments. And then unfortunately, we do hear sometimes from first-time attenders that they were turned off from a group, specifically brain tumor groups, because some of the members looked very ill, and they just didn't really want to see people further along in the diagnosis that weren't doing well. And so attending the support group for them brought up a lot of fear about their future, and they just didn't want to face that. So that's something to consider as well. And then there's also the mismatch between the individual and the group, whether there's significant age differences, gender, domination, whether it's, maybe all women caregivers and there's not enough men, just a lack of connection with other members, and that we talked about the topics weren't relevant to the individual. So making sure you're doing those evaluations. So caring for the support group leader. This is really important because this is a tough job. Being a facilitator, is emotionally and physically draining, and you want to make sure that you're caring for yourself throughout this experience. Some of the best ways to do that are set limits for yourself. You really can only do so much, especially if you're meeting quite frequently. Maybe it's time to kind of tone down those meeting times and set it to maybe once a month versus every week or every couple of weeks. As mentioned, a co-facilitator really serves as a backup if you need to miss a meeting, and it's really good to have someone there to share in those difficult times. It can kind of ease the stress that you may be feeling from facilitating the group. Be sure to learn to say no. You're not being selfish, you're just really avoiding any type of overload. So if the members really want to have additional activities or are just looking to you a lot, learn to say no and know your limits. If you need to ask for help, ask a member from the group. They would probably be really honored to be asked and would be appreciated being needed. So that's another tip. And take care of yourself physically. Make sure you get a good night's sleep and eat before the meeting. And seek counsel from your support network or a therapist just to kind of share your feelings from the group. You're going to be talking about a lot of deep topics, and you're experiencing the group dynamics also. So really distress or sorrow shared is lessened, and encourage you to talk to others about any of your feelings you're having. Being a support group facilitator, especially for people with a brain tumor, can be emotionally draining. So prayer, meditation, and relaxation exercises can kind of recharge you and sustain you emotionally. And really relish in that gratitude of the group. Know and realize that you're benefiting the group members significantly and making an impact on their life. So ABTA knows the importance of having support groups for patients and their loved ones, and really appreciative of you stepping up into this facilitator role and making this available in your community. We want to support you in those efforts and provide you with the resources that you need. So as you're kind of embarking on starting your group, turn to us. We'd love to list your support group on the ABTA website. You can access the trainings like you're participating in today. And then we have a support group facilitator resource center on our website, and this will have really great meeting agenda templates for you and facilitator tips on an ongoing basis. We also have a ABTA healthcare professional e-news that's specific to professionals kind of working with this patient population, and offers tips and articles that could be of importance to you. And then certainly we love to share our publications with members, and that information can be really beneficial, especially for those newly diagnosed or patients who have had a recurrence. So these publications are offered complimentary, and you can request them on our website, abta.org. So in closing, I encourage you all to remember the work of Yellen. We talked about how support groups can offer a wonderful environment for patients and their families to receive hope, to share information. It's a place for them to offer help and be helped by others, to learn skills to face difficult decisions and situations, to express feelings that they haven't shared before, to find a place where they belong, and ultimately confront mortality by living honestly and less focused on trivialities. Members can also encompass patients and caregivers in different points of the diagnosis. Really encourage you to get a co-facilitator and take time to plan your meetings and set agendas. Make sure you establish ground rules and stick to them. And as a facilitator, you have an important role to encourage participation and manage conflicts as they arise, and hopefully the tips within this presentation will help you through those. Want to make sure that you're noticing when members don't return and seek their feedback as to why, so that you can make changes within the group to meet their needs. And no matter what, remember to take care of yourself physically and emotionally through this entire process. You want to make sure that you're in a good place when you're taking on the facilitator role and really able to provide the group your best foot forward. And finally, be sure to reach back to ABTA for support and resources. So thank you so much for your time, and best of luck to you all as you begin starting your support groups.